Thank you very much, Chairwoman Eshoo and Ranking Member Burgess, for holding this important hearing, and to our three witnesses for being here with us today. And I'm particularly happy to welcome Mr. Lee, who is from my home state of California and who I see an awful lot in Sacramento. I was struck by a few things that all our witnesses agree upon. We all agree that the ACA has resulted in numerous positive changes for Americans: consumer protections, expanded access to coverage, and historic lows in the number of uninsured Americans. We also agree there is an opportunity to build on the law. There remain gaps in coverage, affordability challenges for consumers, and market challenges for insurers. As we heard from Mr. Lee, California has made a significant investment in marketing, outreach, and enrollment assistance for consumers. A key component of this investment was funding the California's Navigators program, which plays an important role in enrolling populations, especially underserved populations, in health insurance. A new law taking effect this year in California bans the sale of short-term limited duration insurance in the state. Last month, our committee held a hearing on these types of junk insurance plans and learned how consumers can be duped into buying these products without knowing they don't cover pre-existing conditions or certain essential health benefits. Mr. Lee, does California's Navigator program help Californians enroll in these types of junk insurance plans?
Thank you for the question. Absolutely, it does not. They cannot. The short-term plans actually in California are not allowed as a matter of law, and we make sure that our navigators and our certified agents are promoting policies that actually provide good essential benefits.
So you don't at all advocate. Great. Like California, you've heard about the success of Massachusetts at achieving nearly universal coverage. As we heard from Ms. Morse-Gastier, this happened through strategic investments, outreach, and policy. Ms. Morse-Gastier, in your testimony, you note that the Massachusetts Health Connector uses data to better understand and reach individuals without coverage and communities at greater risk of uninsurance. Can you elaborate on how you reach these populations and help them enroll in affordable coverage?
Thank you for the question. We use both national, U.S. Census Bureau, and local sources of data to understand population and demographic dynamics around populations that have a higher risk of uninsurance. And then we use that data to actually select our navigators that we include in our program. We work with 16 navigators, and they're strategically selected to help us make inroads in those particular populations, not just because of their physical presence and their sort of trusted role in the community, but because they have particular tools to overcome the barriers that we think people in those specific populations may be facing, whether it's language barriers or accessibility to in-person assistance.
Oh, that's wonderful. I'm pleased that Covered California, and we have Mr. Lee here joining us to share in the state's success story. As we heard today, Covered California has been on the front lines of implementing the ACA, serving over 3.4 million Californians since 2014, lowering our eligible uninsured rate to 3% and working to keep our premiums about 20% lower than the national average. Mr. Lee, what are the unique characteristics of Covered California that allowed you to steadily increase enrollment and keep costs low and maintain competition?
Well, first, we aren't unique. We were thrilled to do this report jointly with the state of Washington, state of Massachusetts. Other states that have leaned in have used all the tools specific to their state. But I'd note it's been number one, focusing on marketing and outreach. Number two, having common patient-centered benefit designs, and when people sign up for our plans, whether they pick Kaiser, Blue Shield, or Anthem, they have the same knowledge that when they go to see a doctor, there won't be a deductible they need to pay before they see their doctor. That means consumers see the value of insurance. And finally, I'd note, we actually focus on the underlying cost of care. We have contractual requirements with our 11 health plans to have them look at the delivery system, making sure people get the right care at the right time. Those factors together, we think, are part of our formula for building what we hope will be successful over the long term.
Well, thank you. Ms. Morse-Gastier, your state has also taken a proactive approach going back to before the ACA. What lessons can you continue to apply from Massachusetts to the federal marketplace?
So I would say that we focused again on trying to bring in healthy, low-risk people into the marketplace by doing data-driven outreach to them, and also really work to have a very stable regulatory environment where we keep our eyes on the road in terms of keeping the market stable. We work really closely with our carriers, which is something that we're able to do as a state-based marketplace and being in very close contact with them. And I would just say more broadly, in Massachusetts, we've had sort of a bipartisan cross-stakeholder support for our health reform effort, and that has continued through the 13-year experience of our coverage expansion efforts, which has been critical.
Well, thank you very much. And Madam Chair.